The chances of surviving a stroke and avoiding disability improve if emergency treatment begins rapidly. That's why it's so important to know the signs of stroke, because recognizing the signs is critical to providing a quick response to them. Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. A stroke happens when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. And when that happens, part of the brain cannot get the blood and oxygen it needs, which can cause permanent disability or even death if not quickly addressed. Stroke is the number 5 cause of death in the United States and a leading cause of disability too. But Hispanic people in the United States face an even higher risk. Stroke is the number 4 cause of death for Hispanic men and the number 3 cause of death for Hispanic women. That's why researchers developed a Spanish acronym to raise awareness of stroke symptoms in the Hispanic community. The acronym is RAPIDO, R-A-P-I-D-O. RAPIDO stands for rostro caído or drooping face, alteración de equilibrio or loss of balance, pérdida de fuerza en un brazo o pierna or loss of strength in an arm or leg, impedimento visual or visual impairment, dificultad para hablar or difficulty speaking, and obtenga ayuda rápido, llama a emergencias, or get help fast, call 911. Here to talk to me about Rapido is Dr. Mauricio Gonzalez, a specialist in internal medicine and better known to his patients and his 1.6 million Instagram followers as Dr. Mao. Dr. Mao, welcome to House Calls.
Thank you, Dr. Sanchez. It's a pleasure to be here.
A CDC report found that even though Hispanic adults had similar rates of stroke, fewer Hispanic adults knew the signs of stroke than their peers. So it seems that creating this new acronym could be a real game changer for our community. What do you think about it?
I must say that I think this is the most significant step the American Heart Association has done for the Latino community. Why? Because in the Latino community, we have a strong caregiver system. So it's not only for patients, but for caregivers. And this Rapido acronym is catchy, it's understandable, resonates with our culture, it's phenomenal in every single sense.
I love that you brought up the expanded caregiver community, because people might think that only they need to know the symptoms of stroke if they're having one. But no, all of us need to be able to recognize the symptoms. Can you talk more about that extended caregiver community and why it's so important to focus on them?
Something we've learned from multiple studies, especially on social media, is that sometimes messages and campaigns do not reach the patient, but they reach the caregivers. Daughters, sons, nieces, nephews, and they're part of that ecosystem of prevention. So we know that focusing on them, it's also a great add-on to this ecosystem of prevention on media.
I agree. What about healthcare professionals? What should healthcare providers and organizations do to raise awareness of Rapido?
I think it's just a matter of drilling down, how we say in the communication business, right? We have to put this out there in every single part. Offices, government institutions, it has to be on social media, podcasts, TV, all day long. Repetition is that how we learn. And also it's very important because these kind of campaigns, they not only teach you how to recognize a stroke, but it also teaches you things around it, like prevention, outcomes, medication. So overall, it's gonna start to inspire different conversations that might help us.
I hope you're right. It's such an important conversation. But I'm curious, before Rapido, what do you think was missing for the Latino community in terms of stroke awareness?
So I specialize also in emergency medicine, and I can tell you from firsthand experiences that when you have Latino patients in your ER having stroke symptoms, it's truly confusing to them to hear all these acronyms in English. And with everything that is around this acronym and everything that is about treatment of stroke is not culturally sensitive. When you speak about Rapido, you focus on what matters to them. So they feel heard, they feel seen, so it starts the conversation.
Absolutely. Can you talk about why communication is so important to people's health? or maybe about what happens if there isn't good communication between people and their healthcare providers?
That's a phenomenal question. So we actually have data from the Pew Research Center. 48% of Latinos in the States feel like their healthcare experience lacks communication. This is a huge issue. We're not speaking about a 3%, 2%. We're talking about 1 out of every 2 Latinos in the United States feel like they lack communication. And we know firsthand, we learned this from med school, that unless you create a good communication basis with your patient, you will never establish rapport. And most of the diseases nowadays are chronic diseases, which means that we're gonna be seeing these patients a lot of times during their lifetime. And if we do not establish communication early on, it's an obstacle for them and for us and for society.
So would you say that the big obstacle is that things are in English and not in Spanish, and we just need to be translating more things into Spanish?
Communicating effective healthcare is not about translating words. It's about being culturally sensitive. We know that how we speak, the tiny clues that no one sees that are embedded within our culture are important. And just to give you a quick example, there have been studies, mostly in Miami, where people who were afraid of needles for vaccinations or for any types of medications, a Spanish-speaking doctor would talk to them and say, hey, this is just pequeña agujita, which is like a little needle, which makes no sense in English. But for our culture, it means that the doctor is telling the patient that this is a small needle, that it's not gonna hurt, that they're gonna be okay. So there's a lot of significance around those little clues. So that's why being culturally sensitive is incredibly important.
Before I let you go, I want to revisit the RAPIDO acronym to remind people of the symptoms and what to do. RAPIDO stands for rostro caído, or drooping face, alteración del equilibrio, or loss of balance, pérdida de fuerza en un brazo o pierna, or loss of strength in an arm or leg, impedimento visual, or visual impairment, dificultad para hablar, or difficulty speaking, and obtenga ayuda rápido, llama a emergencias, or get help fast, call 911. So Dr. Mao, if a patient is experiencing any of these symptoms, what should they do?
I think the most important thing is to dial 911, but I also want them to recognize the urgency of the matter. We know, as we say in medicine, time is neuron. The more time passes between the onset of stroke symptoms and being treated in the hospital, the more chances the brain will suffer. So we have to recognize it early and we have to address it. One thing that arises specifically within the Latino community is that they start thinking about alternative diseases. They say, this might not be a stroke, this might be just a stress, they might be dizzy. It really doesn't matter. As soon as you recognize any of these symptoms, you have to dial 911.
Perfect, Dr. Mao. Thank you so very much for being here today and sharing your expertise.
Of course, my pleasure.
Let's recap some key takeaways. First, we now have a new acronym, RAPIDO, to help us remember the signs of stroke. It's important for Hispanic persons to know the signs of stroke because we face a higher risk of death from stroke, and studies show we're less aware of the symptoms than our peers. And finally, translation is important, but being able to communicate in culturally relevant ways helps establish rapport between patients and doctors, which is essential for keeping people healthy. If you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.